Hello, nice to have you in this wonderful edition of You and Your Health as we continue our operation. Total health to all through the power of knowledge. Looking unto God and believing in that by the year 2025, there should be a great story to be told about the healthcare system of this country in relation to the knowledge available to the people. And that optimism we have to have a very unique subject to discuss today. Good news to everybody. A stroke patient can recover 100%. You have the opportunity to know today. A person who is suffering from heart-related problem can recover, can live life again. A person who can't work, who can't be able to do anything or exert any form of pressure because of heart failure, such persons, they have a chance not just only to live, but to be able to go back to business. These and many more will be able to talk today when it has to do with cerebrovascular diseases. But before I go into that will be amazing to everyone, I want you just to please call your friend. Whatever you are doing right now, please can you listen to me? You know what? Whatever you are doing right now, many have done, and in the course of doing it, they say they have stroke. They never return back to office. They never return back to business. On that very accord, I want to encourage you to see what can make you not to be one of the statistics in that cloud. Be that as it may, call your friends, call your loved one to tune into this station right now. I tell you, you are giving them a certificate of life for just that call. Do it right now as we go on. Stroke is preventable, and as a matter of fact, someone can recover 100%. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. If you are just joining us, You and Your Health, a program sponsored by Dr. Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. I remain your friend, Dr. Richard Okoye. And we are looking at a very critical subject today that has to do with cerebrovascular diseases. The American Heart Association actually confirm categorically and statistically that 1 out of every 3 deaths that occur in America result from stroke or heart-related problems. 1 out of every 3. Of course, you know here our statistics, unfortunately, has been the evil and the demons and the people that kill. If somebody has stroke, it must be like his enemy. If somebody have a heart disease or having inability to walk again, it becomes as if, the enemy and those that don't want him to prosper and all that. That has been our autopsy and our own statistic. But we can understand on a general note that stroke and heart-related problem has been the commonest cause of death also in our environment. But the good news, as earlier mentioned, is that a stroke patient can recover 100% following the occurrence. And I will tell you how such could happen and what is available right now that can make it happen. That a person who is down because of the issue that has to do with heart failure, because of issue of heart attack, because of issue that has to do with one thing or the other related to the heart weakness, cardiomyopathy, such person can not only be in position to be better off in life, but also be able to be useful to himself and the family. These and many more we will talk. However, we start first of all on the subject of stroke. Listen to me, because it's quite a tragic situation where a man that used to be, by reason of our conventional use of words, hale and hearty, he was fine, and all of a suddenly the man couldn't wake up from bed. He said that his leg is paralyzed. He said it sounds so tragedy. It sounds mysterious as it were. Little wonder we usually refer it that it must be an enemy that is responsible. All right? But let us look at how this is stroke. What is stroke? Did you know that stroke is not a disease? Oh, you may be shocked to hear that. Stroke is not a disease. Stroke is rather an accident. It is called cerebrovascular accident. An accident that happened just because of something like pulsar, and it just happened like that. So that pulsar, and the person couldn't walk, and the person started having some of the changes in with her, is what is called stroke. All right. So just like an accident can be prevented, so also stroke can be prevented. All right. So on that very accord, we are going to look at the very subject of stroke. For you to understand this subject of stroke, I want you just to understand me. Look at me right now. Did you know that I'm just talking? Crack, 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 crack. Do you know who is talking? It's not this mouth. This mouth is just something that's under remote control. Just like you have your brain box inside your car that regulate everything. If anything is removed from that brain box, the expected area of performance will not, the light may not show, the gear may not work, and so many things like that. So also, it was the leaf that was taken from human brain that the brain box of a car was developed. In other words, everything you see me doing right now, I'm not doing. The legs have no contribution. It is the brain that is saying, okay, come on, boom, boom, boom. And I dance, and dance. Who is dancing? It's my brain that is playing the piano on how my movement should be. So, whenever you see a case of a stroke, my friend, forget about that leg, forget about that hand, forget about the areas of weakness. Think the brain. Think the brain. All right? So it is the brain. That's why some people will say, no, there is this person that has stroke. There's a place if he goes to take the person, and the person will start walking, and they will be massaging and doing all manner of things on the legs. No. What happened in every stroke related cases happen in the brain. All right? So let me show you something that you will appreciate very nicely here. This is very important for you to understand this fundamental, okay? By understanding of this, you will easily understand what happened. This is the skull, my friend. This is your skull, male and female. This is how you look. My friend, all these things, I'm very beautiful, I'm very handsome. See the original you. Drop your hand, okay? There's no amount of makeup you will make up to change this figure. So he found out that the only mask God just use cover you. If they just remove the mask here, this is the main you. All right. So you need to know how ugly. That's why the Bible says you are fearfully and wonderfully made. Look at it. If they keep you like this, everybody will take off. Okay, but let's get to this. Okay, this is the skull. Your skull when you were a baby. Okay, and when a baby is born, the skull usually come from this. You have this very opening. This is what is called anterior frontal. It's also another one at the back. All right, but the essence of God leaving this thing is that at the early stage when a baby is born, the brain has not finished developing. Very, very vital, I tell you this. The brain complete development 18 months, that's a year and 6 months after delivery. So at that very point in time, he leaves this very gap to enable further development. Another importance of this, very critical, is that God allowed this very gap in case of the baby while coming out from the birth canal. If the mother's birth canal is a little bit small and the baby is coming out, instead of allowing the compression, if the whole thing had been fixed, instead of allowing, so God created this gap in such a way when they come there and it's fixed, the skull can collapse a little and the baby will come out. After the baby come out, it can also expand again. So it's actually designed for a number of things. The pediatrician can also collect cerebrospinal fluid from here. Okay, so these are some of these things. But did you know that after 18 months of life, on a general note, this will close, boom, boom, and as soon as this is closed, boom, it means that for inside of the brain, nothing else is permitted to go in there. Wherever any of the brain tissue is, that is where it will be for life. It's not expanding, it's not getting, so anything that happens to quack it, it will cause problem. Now, to help you understand this better, you find out that this is a woman brain, all right? There's a division at the middle that made this brain be in two fronts, all right? So you have the right hemisphere of the brain and the left hemisphere. So these are the things, and this particular brain, this very side of this hemisphere carry the wires, just like you have the brain box and the wire connected. As it comes this way, it goes this way and supply all the ones, this hand and this one. And this one also goes in this way and supply this one and this one. That is the reason why you hardly, except in a very severe case that go down to affect the two sides of the brain, most times you discover that when somebody has stroke, the four hands and the two hands and the two legs don't paralyze the same time. All right? It's usually either one side will paralyze, because if it happens here, it paralyzes here, and if it happens here, it paralyzes here. I guess you get the picture right now. Okay, stay tuned. I'll be right back. And when I come back, I will now tell you why stroke happen, what causes the stroke, and the warning sign you can't afford to miss. That stroke does not always just happen. There are signs that will give you and know that the worst is about to happen. If you pick it, you can avert the major sickness. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health. If you are just joining us, I'm Dr. Richard Okoye, the president of Doctors Save a Life Foundation. We have a vision by the year 2025. Nigeria life expectancy shouldn't remain this way. No, people will get to know what to do and do it at the right time, and therefore averting being member or part of that ugly statistics. And the commonest by American Association put it clearly that stroke and heart diseases happen to be 1 out of every 3 deaths that occurred in America. And here we can't deny the fact that a lot of people have gone as a result of stroke. A lot of people have gone because of heart-related problems. And that's what we are trying to address today, at least in a language you should understand. Not in the language of the doctors, because most times you see people, as I'm talking to you right now, somebody will have stroke. They will take the person to somewhere, either binding one witch or binding one wizard, creating more enmity in the society. Rather than reconciling people to God, we are now causing more harm and causing more enmity among ourselves because of ignorance. Even God said that my people are destroyed for lack of knowledge. You can listen to me now and get to know that very stroke you are suffering has nothing. That person that has stroke has nothing to do with the enemy. Excuse that very fellow so that we can do the right thing. Let's start from the known before we go to the unknown. So we are looking at the subject of stroke today, and we established that the brain has two formats that supply this side and this side. All right. So having said that, now I want you to understand there are two types of stroke. That's why I will have the opportunity to tell you that somebody that has stroke can recover 100% recovery, 100%. And I will tell you that. There are two types of stroke. You have the one they call hemorrhagic stroke, and then you have the ischemic stroke. All right? Hemo simply means blood. All right? Ischemia means there is a blockage that leads to loss of, that absence of blood. Ischemia, that blood did not get to here. In further interpretation, stroke can occur when there is a bursting of the blood vessel inside the brain. You call it hemorrhagic. All right? Then you go further to have, if there be a problem, a situation where the vessel supplying the brain get blocked, that blood didn't reach to the brain anymore to supply oxygen and glucose and all that, the brain cell will die, and at that point you call it ischemia, ischemic stroke. All right? Now, taking a leave of that, I want you to see something here. These are all blood vessels coming from the heart and also getting into the brain cells. You can see some of the blood vessels here. All right? Tiny, tiny, tiny blood vessels. In a situation where somebody has something like pressure inside the blood vessel, it is discovered that you have big vessels here. Sometimes they have opportunity where they can expand if there's pressure. There's a space, all right? But inside the brain, as earlier mentioned, there's no space for you to be in position to whack anybody. No, stay cool where you are. That is the rule. And in a situation, somebody that now has something like high blood pressure, all right, or having what is called aneurysm. Aneurysm is the bulging of the blood vessel. And somebody who has something like high blood pressure, all right. So in a case of high blood pressure, you find out that when pressure start hitting, all those tiny, tiny vessels right there inside the brain, what will happen? The pressure the thing will be tapping other brain cells. The person will start saying, oh my goodness, headache. The headache will be there. The person may not be able to sleep well, all right? But he may be taking paracetamol or thinking that his enemy has come again. So it will just continue. And if that pressure goes, some people you will say, let me tell you, when your blood pressure goes up to 180, 120, that is a stroke level. Anything can happen. Anybody whose BP has gone above 180, 120, the person is living by mercy. It's just walking by mercy. That's why attention should be given to your BP. Don't have anybody to blame. Ignorance is about to kill you and you need to give attention to it now. Because right there as a man, your presence in your home is a moral booster to your children with or without money. Take good care of your health. As a woman, I always said, your presence in your family may be the only reason your children may not be slaves in their father's house. You have to be alive. You have to be well. Your BP has to be put under control. So when that BP goes up, the blood vessel may be saying, Chai, do something before something do, or do something before something, boom, it will burst. As soon as it bursts, it starts leaking blood inside the brain. By leaking the blood, it will start pushing some away. Any portion of the brain it pushes that doesn't receive blood supply, bam, that one will die. And once that one starts having problem, if it is this side, it will cross the wire here and the whole of here will be paralyzed. That is stroke, all right? And at that point, you call it hemorrhagic, all right? Now, I have something to tell us here. Because in a number of occasions, he said, whoa! Somebody will be crying. You know, they say they don't do they've done my dad's stroke, my mom's stroke, you know. And I said, it's not hypertensive, it's not diabetic, but it's just having stroke. No, listen to me. A person that is not hypertensive, not a non-diabetic, yes, can have stroke. I say it again because this one will enter well. Listen to me. It's not something that, he has stroke. No. A person can have stroke with or without BP, with or without diabetes and other related illnesses. Yes, it can happen. Here, there's what is called ischemic stroke. Ischemic stroke happens when there is a blockage of the blood vessel. Just like you can have a heart attack, you can have a brain attack at that point. By the reason of that very block, blood will not flow again to the brain. Get that very picture. If there be a blockage of this, you find that this portion of the brain will die. And the death of this portion of the brain is what is also called ischemia. And this ischemic stroke results from blockage of the blood vessel. That can also happen when there is a heart problem whereby the blood comes in clot. What I mean when they talk about clotting of blood, you know when you do something like pap, you know, Akamo. When you do pap, sometimes it will form seeds will be inside. That is what is called clotting. All right, it's a situation where there is a clotting or such inside, and it flies inside the blood vessel and get to the brain. Those tiny blood vessels are small to pass down. It may block it, and all the portion where it's supplied will die, and you will have something like this. All right. So when you have something like this very person will have stroke. Okay. Now, I want you to stay tuned when I come back, and I will tell you that this very person that had this stroke can recover 100%. 100% if something is done at the time I will tell you. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
I cannot believe it that this is the same me that came here with not having the hope of being on my feet again, that I can walk again like a normal human being. I want to thank Doctors Save a Life Foundation for this wonderful work. To God and to God only be the glory.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, and I know you are getting something here. Please don't forget that this is an effort being made to deliver our people from health ignorance, which has been the commonest cause of death in our environment. Today, the issue of stroke has been very critical. But before I tell you something that can be done to reverse stroke to the point of 100%, one thing you should know is that stroke does not always just happen. No, it must have given signs. And that's what is called transient ischemic attack. Transient ischemic attack, otherwise called mini stroke, but nothing like mini stroke, is a serious problem, because if it is not, something is not done, the worst can happen. So, in that very case, the person may just be, all of a sudden, he may have certain level of weakness, inability to move. You see, as if he staggered to fall. What's going on? What's happening to me? He may have a form of blood vision. It's not seeing clearly. Sometimes some level of blackout. Lightheadedness can come. Dizziness may just be as if you want to just fainting attack. It could happen. Sometimes the facial nerve or the nerve, the face will just become as if it's numb. I'm not feeling my hand very well and all that. Sometimes that weakness. What's going on? Yes, some occasion you can have what is called facial nerve palsy. You see, some people just wake up, nothing has happened. I don't know what I just don't want to myself. Yes, that can happen. Somebody had it and was saying that they say that spirit slapped him in the dream. You can imagine that, my friend. No spirit slapped you. What it means that the facial nerve that supply this side, they balance each other. If this one becomes weak, this one will drag the one to one side. There's nothing spirit slapping you. It's ignorant that is about to allow the worst to happen, because such could happen and within 24 hours in most of the cases may go. Alright? And the person recovers. He say, I was weak but I don't recover. My friend, you have not recovered fully. You need to be able to find what caused the problem and start working toward preventing recurrence, because it can happen again, and when it happens, it may be too late. So that's very ignorance, what we're talking about today. And on this particular occasion, you remember that I said there are two types of stroke, all right? And when stroke happens, you need to know whether this very type of stroke you have, is it hemorrhagic or is it ischemic. Ischemic is the one that there's a blockage of the blood vessel, usually by a blood clot. All right? And that very blood clot will be in position to and not allow blood to reach. You know, in a number of occasions when there is something like pulmonary embolism, when there's a blockage of the artery to the pulmonary artery, or when there is something like all the deep vein thrombosis, you see somebody leg will just swell here and it will be causing pain and all that. That's very dangerous. It can send such a bolus and be blocked somewhere. When such a block happens, conventionally we tend to give all this clezine, heparin, you have clopidogrel and all the rest, and aspirin. Yeah, those ones can prevent further aggregation or further forming of that clot. They prevent platelet aggregation. So on that very account, they will prevent further collection. Be that as it may, there happen to be a group of drugs, it come in injection form, that is called tissue plasminogen activators. There are different formats. You can do streptokinase and ukinase and all the rest. They are there. This very product, though expensive, but if a person that has this type of stroke, ischemic stroke, is taken to the hospital within 4.5 hours of this very stroke, or having a mini stroke, before 4.5 hours, if such person is taken to the hospital and where that injection is available, if it is given direct, it will just automatically burst. It will burst that very clot already formed. That's why they call them clot busters. That very clot can be busted, and once it is busted, instantly blood flow will be restored, and this person can recover 100% in any form of deformity that is about to take place. All right, but that can only be given to a person after evaluation. There is no bleeding tendency elsewhere. All right, like in hemorrhagic stroke, it is contrary indicated, and some other things where the person is bleeding. But if no other contraindication has been found by the doctor and that injection is given, this fellow can have 100% recovery. The same thing also can be applied when there is a peripheral blood collection, where you see something because of blockage of the vein, you see the leg will just be swollen. Using this very equipment, this is what is called cath. That very vessel can be traced, and where that very block is, that injection can be given. And when that injection is given, it bursts that very clot, and instantly blood flow will be restored. These are some of the interventions that can be done in a time like this to save people that have stroke that is of ischemic origin, or somebody that is having heart attack, whereby the blood vessel is also blocked and something can also be done. These are all available in our own time. But most importantly is to prevent whatever that will lead you to having ischemic attack of any kind. If you are smoking, my brother, stop. Yes, something must kill a man. You are not living for yourself. You are living for your family. You are living for your friend. You are living for your children. Have a reason why you shouldn't take your life. Let it be that is a situation beyond your own ability, but not when you will use your hand to kill yourself. Excessive alcoholism, yes, could be in position to cause a problem to you in that regard. The issue that sedentary lifestyle, 247, you are seated in one place. My dear, get us small, do a walk. And most importantly, if you are hypertensive, diabetic, please, if you have any form of heart disease, please do not keep quiet. A lot can be done in the heart today to bring somebody, even in heart failure, back to life again. These and many more God has made available in our time. We cannot continue to die because of ignorance. Don't join that ugly statistics of 54 years life expectancy for Nigeria. We are saying no to it. Join us by doing the right thing. Encourage other people to do same. Together, we'll have a course 2025 to celebrate the longevity which is in line with God's word. God bless you. That is much you will be able to take today. But don't forget to share this knowledge to everyone. It's more than money you will give them for burial. God bless you. As I see you again.